Unveiling the White House Health Tech Pledge. 6 key questions answered. The recent announcement of a health tech pledge at the White House has sparked significant interest and excitement in the tech and healthcare sectors. Over 60 prominent organizations, including industry giants like Amazon, Apple, Google, OpenAI, Epic, Microsoft, CVS Health, and United Health Group, have joined forces to commit to a set of ambitious goals aimed at enhancing health data sharing standards. This initiative is not just a formality. It represents a collective effort to drive innovation and improve patient care through technology. But here's where it gets controversial. What does this really mean for the future of healthcare? Mario Aguilar, a seasoned journalist specializing in healthcare technology, has been closely following these developments. His insights delve into how advancements such as artificial intelligence, virtual reality, wearable devices, telehealth, and digital therapeutics are reshaping the healthcare landscape. He also highlights the various business and policy hurdles that must be overcome to fully realize the potential of these technologies. If you're interested in staying updated on these topics, you can subscribe to the Stat Health Tech newsletter, which is delivered twice a week. The Health Tech Pledge signifies a commitment from these companies to collaborate and make tangible progress by the first quarter of next year. Each organization has tailored its commitments based on its specific role within the industry, but the overarching aim is clear: to facilitate easier access to health data and foster innovation in healthcare solutions. Some companies are even pledging to develop new tools that empower patients, which could revolutionize how individuals manage their health. Brittany Trang and I reported on this significant announcement, emphasizing the potential impact of these commitments on patient data accessibility and the broader healthcare ecosystem. As we navigate this evolving landscape, it's essential to consider the implications of such collaborations. Will they truly lead to better healthcare outcomes, or are they merely a public relations move? This initiative raises several burning questions. How will these companies ensure accountability in their commitments? What specific technologies will emerge from this collaboration? And most importantly, how will patients benefit from these advancements? As we ponder these questions, I invite you to share your thoughts. Do you believe this pledge will lead to meaningful change in healthcare? Or do you think it's just another corporate initiative that will fall short? Let's discuss. Trump announces MAHA, New Era of Healthcare Tech for Better Outcomes. President Trump has unveiled new initiatives to revolutionize healthcare technology and partnerships with major tech firms. The Make Health Tech Great Again event introduced a voluntary commitment from companies like Apple, Google, and Amazon to improve digital health record sharing. Trump officials believe this will enhance health outcomes for Americans by giving patients greater control over their health information. The controversial part? Some argue that the government shouldn't be involved in private healthcare decisions. But here's the thing. Upgrading outdated systems and making health data more accessible could be a game changer. Imagine having personalized tools to make informed choices about your health. That's what this initiative aims to achieve. Of course, not everyone agrees with this approach. What do you think? Should the government stay out of it, or is this a necessary step forward? Let us know in the comments. One thing is clear. This is just the beginning of a new era in healthcare technology. With major players on board and a focus on patient empowerment, we could see some incredible changes in the near future. Stay tuned as we follow the progress of these groundbreaking initiatives. Big tech healthcare giants pledged to make patient data more accessible. What it means for you. Revolutionizing healthcare data sharing has become the newest battleground, with industry giants boldly promising to transform patient access and control over their health information. While many of us are used to seeing tech and healthcare as separate worlds, a recent wave of commitments signals a major shift, and a pretty ambitious one at that. But here's where it gets controversial. These pledges aren't just about better tech. They could challenge existing power dynamics, ownership rights, and even the very way we think about privacy in medicine. Recently, over 60 influential companies from both technology and healthcare sectors signed an agreement orchestrated by the Centers for Medicare and Medicaid Services, CMS. This pledge aims to simplify how patient health data is shared and to foster the development of user-friendly apps that allow patients to view, understand, and manage their health info more actively. CMS Administrator Mehmet Oz emphasized that this initiative hints at a fundamental paradigm shift in how healthcare functions in the United States. Big names like Amazon, Apple, Google, OpenAI, Epic, Microsoft, CVS Health, and United Health Group joined forces to make this vision a reality. These organizations committed to a common goal. By early 2026, they will collaborate to establish dependable, patient-centered, and practical standards for data exchange. This effort will involve creating what are called CMS-aligned networks, a new classification that adheres to the government's latest interoperability framework rules. These standards require the use of the most current data-sharing protocols. Think of it as a universal digital language that promises to make health information more seamless and accessible. This movement underscores a brighter, more connected future of healthcare, where a patient's data isn't locked behind corporate silos, but instead flows freely and securely, empowering people to make more informed decisions about their health. Yet, it's not without potential pitfalls and controversies. Will these tech giants truly prioritize patient privacy over profit? Could this lead to new kinds of digital monopolies or data misuse? What do you think? Are these promises to improve health data sharing a step toward genuine progress or a potential minefield of privacy concerns? Share your thoughts, and let's discuss whether this paradigm shift is a promising revolution or something to watch with cautious curiosity.